Good afternoon to everybody that's joining. What I always do when we start these webinars, I give a couple of minutes just to give people time to join. But in the meantime, I would like to introduce myself. I'm Dr. Rosan Meyer. I'm a paediatric dietitian, and I've worked in various areas of pediatrics over the last 23 years. Today's topic is really about how to guide on how to monitor growth at home. The primary reason I'm doing this now is because many people all across the world are in lockdown. And what I really would like to do is provide them with some tools of how to monitor growth at home, because I do understand that it's very difficult to be able to gain access to healthcare professionals as per normal. And so what I'm going to do is just give you some basic tools with equipment that you might have at home. The way that this webinar works is, number one, that I'll be recording it. And the reason I record it is that I sometimes have parents that have paid and who have either lost Wi-Fi during a recording or would like just to have a revision of the topic. But I want to reassure you that no personal information is shared at all during the recording. I will also share within the next couple of seconds with you a screen with a presentation, and this will be for around 35-40 minutes, and you should have a tab that allows you to send in some questions, and then I will answer those questions at the end. So let's start with the topic on hand, and as I said, it's about the monitoring growth at home. I like to always start my webinars by talking about what I'm not going to achieve today, and I really want to reinforce that this webinar does not replace an individual consultation with your pediatric dietitian or with your pediatrician. It also does not replace standardized growth monitoring equipment. You may be lucky that you have those at home, but the vast majority don't. So it's really critical that when lockdown is over, that measurements are done on the right equipment. I'm also not discussing today measurements specifically for children with neurodisabilities. So those require really more specialist advice, and also there's more specialist equipment involved as well. The last one is just a personal request to all of you. I do not allow for personal information, so any name, date of birth or diagnosis be shared via the questions, because I really keep to the data protection. So by all means send in questions, but really important for me that you don't send in any identifiable information to me. More importantly, what are we going to achieve with this webinar? Firstly, to understand why it is important to perform growth measurements for children, how to do the following measurements at home, and I'm focusing on weight, length, and height. I'm not doing head circumference today. Head circumference for me is really something that remains in the domain of the healthcare professionals, a slightly bit more complicated. And whilst we're doing the lockdown, doing weight and length and height is actually sufficient. I'm also going through how to plot these on a growth chart. I've got some examples really for you, so hopefully they'll be useful for you to take home, and how to interpret this and when you should be seeking help. So why do we need to perform growth measurement? Why am I, as a dietitian, putting so much weight on you performing growth measurements at home? So growth measurements are really a proxy marker for your dietary adequacy. And as a dietitian, it's a proxy marker for energy and protein. There's also specific vitamins and minerals that are linked to growth, in particular, vitamin D, zinc, and you also have other minerals like sodium, so salt, chloride, that are linked to growth. It's also a proxy marker for health. So for chronic diseases, allergy, diabetes, cardiac disorders, we always would like to see growth and see where you are. So it might be that some of you are joining this session because your child already has a diagnosis and you want to make sure that they're growing. But it could also be that you just want to monitor where your child is going. The second reason, it is a proxy marker for acute disease. So it might be your child has just had diarrhea for a week, and so you want to know how bad is the weight loss. And then, of course, growth is also a proxy marker for general well-being, for food security. And I think that is such an important topic that we have at the moment with availability of food to all families around, and also neglect. So that's why it's so important when we motivate parents to perform growth parameters at home. The one other reason is that many of you will be having consultations via video or via phone. So the healthcare professionals that you'll have these consultations with will not have access to scales. So in that regard, we are very much relying on parents to help us. So to interpret growth, you need both length, height, and weight. So you can't do one without the other, because actually your height, you can have somebody that is tall but is actually skinny. You can have somebody that's got a good weight but that's in fact short. So if I have somebody that says actually weight is coming down, but they've always been quite short, then they're migrating down to the mean. Or I might be having somebody that's always very tall. The weight is going up. That does not necessarily mean they are getting obese, but they're actually matching their height growth. And then of course, we need to think about genetics. So the way the height for mom and dad is also important when we are thinking about growth. So I'm going to always split up measurement below 2 years and above 2 years. And the reason I'm splitting it up below 2 years and above 2 years is because there are different measurement procedures for below 2 years and above 2 years, and they need to be respected because that's how your growth charts have actually been developed. So if we start off with the measurement of weight below 2 years. So you can actually weigh at any time of the day. However, when you're repeating the weight, the ideal is that you measure at the same time. So if you're saying, okay, I'm going to do the measurement in the morning, when you're repeating the weight and doing it again, you ideally want to do it at the same time at the morning again. Weight measurements for a child below the age of 2 should always be naked. That naked, the definition is you remove also the nappy. You repeat the weight 2 times if possible. And I know that can be quite distressing for your baby. So have a cuddle in between, keep them calm and have it in a warm environment. But it's so important, especially if you're not used to it, that you actually make sure that the measurement is accurate. So if you do the second measurement, you ideally want to have it within 50 grams of the same. Of course, if your healthcare professional is going to do it, the margin is going to be much smaller. And if your difference is more than 50 grams different, then you want to actually repeat it for a third time. So you've got 3 options available for you to do it at home. So first option is, of course, if you're in the very, very lucky position that you have baby scales, I've just put a photo in there, that you might have those at home, you would actually want to put a kitchen towel or a small towel on the scale first. And that's just to keep your baby comfortable. Sometimes it can happen that there's some urination occurring during weighing, so it's actually just a way of keeping the scales dry. Once you've placed them on, you switch your scales on and you zero the scales with that layer on. Then you place your naked baby lying down on the scales. And this is an important factor. The reason I say lying down, because of course, from 8 months, you will have a baby that could be sitting up, but actually baby scales are quite unstable. And although they hate lying down, it's much safer for them and also much better, because if they're sitting, you find that they're sitting quite unstable. So you'll see the numbers are actually moving up and down. So lying down is the best. Take the reading, and ideally a baby scale is accurate within 2 decimals. So you'd say 6.78 kilograms. And as I explained to you, you would pick them up and repeat it again. So do the whole process again, 0, putting them down. And then you see what your difference is with the weighing. You've got a second option. Second option, which I suspect is what the vast majority of people be now, is I have only got a scale, you know, a kitchen scale, bathroom scale, you know, one that is digital. And I have reinforced Digital is really, really important because a scale that has got the old style where there's just either weights or it's a sign just going up and down, those are really not accurate at all. So the procedure I'm going to go through is if your digital scale cannot zero on you. In some of the very advanced digital scales, if you've got them, you can stand on, you can zero on, and then the baby can be passed on to you. But in the vast majority of cases, you will not have such an advanced scale. So what you'll need to do is you weigh yourself alone on the scale, write the weight down. That is weight 1. Then you pick up your baby, that's the naked baby, so it's exactly the same how you would be doing in a baby scale. Naked baby, you go back on the scale and then you write down your weight 2. So this is your second weight. So you subtract your first weight, which is just the weight of yourself or the parent, from the second baby with the parent. Ideally, you want to repeat. So again, take some time, make sure that your baby is quite relaxed when you're doing this. And the reason always that you're repeating is just to make sure that there's no error that has occurred. Option 3. So I have had consultations over the last months where parents have said, we just don't have any scales at home. So as a dietitian, then I rely on proxy markers. And these questions you then need to ask yourself. So first of all, is your child growing out of the clothing that they're currently wearing? And what size are they? So if your baby is 4 months of age, are they between 4 and 6 months in terms of clothing, or are they still remaining in 2-month clothing? And you are not seeing that they're growing out of that. If you got in addition to that an appetite that's either worsening or the same, and I have seen now with the lockdown, especially in older children, it's not only become better, appetite's gone excessive. So children are bored, there's not the normal activity. So where they've had quite normal appetite, you've seen them actually gone up. And that's also an important question. Does your child have any other worrying symptoms? Diarrhea, vomiting. So these factors can exacerbate weight loss. And then most of you who would have joined the call would have had a growth chart with previous weight. So how was your baby tracking before that? Were the doctors, were the health visitors highlighting some problems before? Because of course, if you had a very robust child before, really growing very nicely, and you said to me, actually, baby's growing into new clothing, it's eating the same, no other symptoms, then there's no concern. But if your baby was on the lower centiles and you said, actually, appetite is not that good and the growth is a bit slow, then there is a little bit of a concern around growth. And I'll tell you at the end how to access help or when to access help. So what now? We've done below the age of 2. What about weight above the age of 2? As I said, there is a difference, and in particular, the difference comes with the clothing or no clothing. So the rule in terms of weight management, you can weigh it also at any time of the day, but you really, when you repeat it, want to weigh at the same time. So in children above the age of 2, you can weigh in light clothing. And when you're weighing with light clothing, remove hair accessories, socks and tights, and repeat the weight twice if possible. And if measurements are very different, then a third time. So weight measurements at home, if you performing them, I've already shown you, you would not use a baby scale for a 2-year-old. You would actually use a normal digital scale that a child would just be standing on. This time you would not be holding them, they'd be standing on there themselves. If you again don't have any scales, you'd follow the same guidelines as I've just done before. So that's really important also to then compare the differences between weight measurements of previous weights that you've had. So now, what about measuring length or height? I'm sure you've heard these terms used, and a lot of parents ask me, surely they're the same. Actually, there's a very important difference. if as a healthcare professional I talk about length, it means it's lying down. So your picture on the left hand that you're seeing. If you're talking about height, it is standing up. And the reason it's so important is that the growth charts are actually developed according to these definitions. And it's really important, therefore, to measure lying down below the age of 2 and standing up from the age of 2. Irrespective if your toddler that is 14 months can already stand, there will be a huge measuring error if you're actually doing a standing height versus a lying down length and plotting it. So that's really an important difference. You can already see when I talk about important differences. You see on the photo, I wanted to point it out, this child has got socks. So we'll talk about important differences. You would never do a height measurement in a child that wears socks. Okay, as before, we're going to look at measuring of length below the age of 2 years, and that's lying down. So we have 3 kind of measurement devices. Your ideal measurement device is a kiddie meter. So supine meter, it's static, it's hard. Vast majority of parents don't have them at home. They're quite expensive, but just that you know, that is really your gold standard that you want to be measuring, and that's what your pediatrician would normally have. The second one is a rollometer. So when I say a rollometer, so this is flexible at the bottom. So you lie it down, that can be on a table or on the floor, and the bottom is then pushed up. They're not as accurate as your static hardboard kiddie meters, but they're a good second. And then, of course, your third is just a normal measuring tape. Most of us will have a normal measuring tape at home, and that's going to be your primary tool for doing length or height measurements at home. So making do with what we have at home. So I'm going to talk about a couple of things that we need when we're doing the measurements. So you want the floor, and don't worry, we're not going to put your baby directly on the floor. We're going to use a towel. I would not be using a kitchen towel that's too flimsy and would be breaking, and then you're actually risking your baby being directly on the floor because it will be also done naked. Then second piece of equipment is a measuring tape. Third, any sticky tape. And then lastly, a hard cover, not a soft cover book, a really hard cover book. Does not need to be a very thick book, but one that really does not bend. So once we've got these equipments from home together, then we need to think, what are we wanting to achieve? What we don't want is lying a baby on a bed just like that and actually just putting the measuring tape next to each other, because you can see a couple of things are wrong here. You can see the legs are not stretched out. You can see also that if it's on a soft surface, what happens, the bottom ditches in, that's a couple of centimeters that you lose. And here the baby's neck is lifted, and if the baby's neck is lifted, not only is your head different, but also we have lost a couple of centimeters with a flexing of the neck. Your ideal position really is where they're flat and they have a headboard at the top that is really touching the top of the head, and you have also their feet at the bottom and you flex up their feet and push down the knees. You can already see that this is not possible with one person. So ideally, you as parents can do it together, or a granny can help, or whomever is available and that is able to understand the instructions can do it at home. So to achieve this ideal measuring device at home, you want to stick the measuring tape on the floor. So from the skirting board to about 80 centimeters. So find the skirting board on the floor and stick it straight for around 80 centimeters. And you can stick it several times from the skirting board, which is 0 or, to 80 centimeters, so that it's really nice and fixed. Next to it, not on top of it, next to it, you actually put the towel. So you ensure that it covers the area for your baby. So you don't put a really small towel where you actually know your baby's feet are going to stick, or where the head is not really on the towel. You want your baby to be fully on a towel so that they're not lying on the floor. Then you've got 2 measurements, and this is important. You don't want to experiment whilst your baby's on the floor, because taking a length measurement can be quite distressing for a baby. So have this discussion: who's going to be at the head side, who's going to be at the foot side, and also have the discussion of what you're going to do. The person that is going to be at the head side, that's the skirting board side, you want to make sure that the head is looking upwards and that you can draw a direct line between the ear and the eye. So they're looking straight up. So that's not a tucked in chin, and that's not a hyperextended neck like that. So that's an important position. So they need to hold it, and of course make sure that the head is really touching the skirting board. The person at the bottom is going to be having the book in one hand, and with the other hand you're actually putting down the knees and flexing up the heels with the book. I know it's not that easy, but I promise once you get the knack of it, it's really easy to do, and you can actually do it quite quickly. So this measurement, once you've done it, so you read where the book comes, and be careful where the book comes. The book comes where you read it. It's where the heel ends, not at the end of your book, which might be, you know, a small book or a thick book. So it is where the heel ends. That's where you're reading it off. And then you repeat it a second time. In the ideal case scenario, you don't want 2 measurements to be more than 0.5 centimeters difference, because that can actually make a difference between are they growing a lot or actually are they not growing at all. As I've already said, it can be distressing for your child. So what my suggestion is here: take your time, pick your baby up, you know, and really let them calm down in between measurements when you're doing this. So now we're moving to measuring height over 2 years of age. So height, as I already said, is standing up. So child should be in light clothing. And you remove all the socks and the hair ornaments. Little girls should have no bubbles on their hair. It should really be flat as possible on the head, and also barefoot on the floor. So what you want to recreate, if you're looking here, is a very static, flat bottom surface. So that means no carpet. You want to have a very straight upper wall, and then you want to have something on the head. So let's see how we can recreate that. So in this scenario, you would not go with a floor with a skirting board. Why? Because if you go with a floor with a skirting board, which is normally actually the skirting board is 1 centimeter of the wall, you don't have them straight against the wall. So that means actually they are leaning against the wall, and you might actually lose 1 centimeter there. So a bathroom, flat surface in the bathroom is quite ideal if you've got that available, so a tiled surface or any other walled surface where you don't have a skirting board. You can do it against the entrance of a door as well. That works also quite well. Again, you will need a tape measure, you will need some sticky tape, and you will need a hardcover book. So what we're going to do, we're not going to stick the tape on the floor horizontal, but actually vertical against the wall. So you want the tape measure to start at 0 at the bottom and move upwards. Here I normally stick up most measuring tape are 1.50 meters. I just say stick it up straight to 1.50 meters, several areas, and make sure that is nice and straight. Then again, you need to have 2 people. So one is doing the top like this picture, and the other one is doing the bottom. So the person that is at the bottom is actually going to make sure that the feet are next to each other and that the heels are against the wall. Hence, so important that it's not against the skirting board, but that it's really against the wall. You may need to also make sure that the knees are not flexed, but nice and tight. And then the second person should ensure that the child is standing straight by looking at where the head is. So similarly the baby. You don't want a tucked in chin, and you also don't want an extended chin here. And that happens a lot. So what is important is to bring yourself down to the level of the child. Because if you're actually looking from the top, what normally happens when you give instructions, the children will automatically tilt up their chin, look at you in the eyes. So go level with them so they look at you. That's the easiest way. And then what you do, you place the book on top of the head, and again, take the reading at the bottom of the book, not at the top, but at the bottom of the book, and you repeat it as well. For a child that's standing, ideally you want the measurement to be within 1 centimeter, and you can remeasure. The good thing about measuring older children, for many of them, it's a bit like a game almost. So it's less distressing than for a young baby. So now you've done your measurement. So the next question is, what do I do with this measurement? So the vast majority of you will have some form of a growth chart. So, and here it's important to say, use the growth chart. If you are in a UK system, it might be what the health visitor has given you. In European countries, you will have other health monitoring books with growth charts. So those are the charts that we use. Or use the World Health Organization charts, which you can download, and there's an app for that as well. All of the growth charts in the world should be based on the World Health Organization database. So they might have slightly different lines, meaning some might have a 10th centile, not a 9th centile. Some might not have a 0.4th centile, but the 3rd centile. But they are all based on the same data. And so that is really important, that we monitored according to the same data that you've had before and that your child has been measured before. Then very, very important is calculating the age. It's absolutely critical for below the age of 1 to have the correct age in weeks. And I see this mistake also in healthcare professional. You go, okay, my child is 6 months of age, so that's 6 times 4, so it must be 24 weeks. That's not the right way, because we all know some months have got 5 weeks, some months are 4 weeks or just below 4 weeks. So that's really important, that it doesn't just work out like that. And actually getting a plot wrong by 2 weeks could mean it looks like your child is not growing, whether actually they would be growing. Then, for those of you who are joining this call, who have got babies that are born below 37 weeks, your baby is born below 37 weeks, you need to also correct for the number of weeks that your baby's been born early. So if you've calculated your baby's age at 16 weeks, baby was born at 36 weeks, you would minus 4 weeks to give a corrected age. So it's also important to get it right if your child before had a growth concern, because just an error with calculation of age can make a difference. I use an online calculator, so I don't put myself through the correcting it correctly. So you can absolutely do it, and there are lots of them. I use an age calculator. I've given you a link here for the age calculator, and you put the date of birth, today's date, and it will give you in days and weeks and months and years how old your child is. So let's put all of this in practice, because it's really important for us to actually do that together so that you can see it and plot it in your own growth chart. So I'm going to give you 3 examples. First example is a baby boy that was born at full term on 17th of December 2019. I've done the work for you already. I've put the data in, and I've got 18 weeks and 1 day. Now for 1 day, I would plot this child on 18 weeks. This is this child's previous growth chart. So you can see that before was around the 50th centile, went up to the 75th, but there was some concern that this child actually came down. So today's weight that you've taken is 7.35 kilograms. So first of all, go down to where you are in your weeks. Although it's not that clear from this chart, all of your growth charts will have weeks at the bottom. So I've drawn the line of where exactly is 18 weeks. And then you put the dot of where 7.35 kilograms is at the moment. So you can see, actually, if I look at my baby's growth from before, they've actually picked up again, and they're more or less where they were before. So in this child, growth has picked up. It's more or less around the 50th centile. I would say to you, there's no concern here about the weight. Let's do the length for this baby as well. So same age and length. Most of the time, you won't have a huge amount of length measurements. This baby before was between the 25th and 50th centile and has been tracking really nicely. So the length today was 65.5 centimeters. So what I first of all do is go down. I take the ruler. Okay, this is 18 weeks. And then I put the dot. And you can see that it's come slightly down. But, you know, especially if you've done the length measurement at home and it's a slight drop, I'm not that particularly worried about that. It's just a question of monitoring. So in this chart, I would say tracking more or less around the same centile. So this chart, I think, I would say no concern. So let's do a second example. So this girl was also born at full term, and on the 2nd of September 2019, again, I've done the work for you. I've plotted the growth at 33 weeks and 2 days, and the weight today is 6 kilograms. So again, you put the line with the ruler. Let's see where this child is, and I'm now putting it at 6 kilograms. Now you can see already with your eyes, actually this baby's gone down. So now the question is, by how much has this baby gone down? Well, look at where the birth centile started. So you can count, that's 1 line, that's 2 line. So this child has actually dropped 2 centiles in weight. And if you're using Z-scores, so that's the WHO Z-scores, it's 1 Z-score that they've dropped. So here there is absolutely a concern about weight gain. So this, for us, it would be a definition of faltering growth. So if this would be the case in your baby, this would be a case for a concern that needs to be highlighted. So let's do a length in the same baby, because we've already seen that the weight has come down, but what is even more importantly, has the length come down? So again, you're going to take your ruler, putting where the length is, you're going to plot where, and you seen, okay, the length before was on the 25th at birth, went up to the 50th, but come down by around 1 centile. So you can say the length is back to the birth centile, but has dropped 1 centile. So this is something to keep in mind, because normally the more acute marker of a child's nutrition that is of concern is is weight, and then length follows a couple of months after. So we can say the concern is actually quite acute here. Now, my last example is a more older boy born at 19th of July 2011. I've already calculated the years. It's 7 years and 9 months here. And the height here has always been on the 75th centile. I just wanted to go on the weight. So if we put the weight at 7 years and 9 months, you can see here that there has been a dramatic increase. So what has actually happened? You can see that the height would have matched the growth here, but what has happened, you've had a huge jump from the 75th to the 91st centile. So there's actually rapid weight gain that has occurred, and we've now gone into the domain of overweight. So what do we do with all these threes? What is the next step? So in the last 2 cases, I've shown you a case where a child was not growing so well, and a child where there's excessive weight gain, which I've also seen during this period of home lockdown with excessive eating. So the first step that I would do is I would repeat the measurement at 2 weeks' time at home, because of course you want to make sure that this is correct. We all know that the ideal would be to have this repeated within a health clinic, but I know for many of you this is just not possible. But if you've got a chart that's going down or up, as I've shown you, that is something that you want to do as soon as your pediatrician's offices, your health visitors, any of those open up. You want to have that verified. If possible, you want to contact your healthcare professionals. During lockdown, the vast majority of healthcare professionals provide some kind of telephone or video consultation service. That might be your general practitioner, your health visitor, your nurse, your pediatrician and dietitian. So it's not that there's no help, it's just that the help is slightly different. So you do want to highlight that because there are things that can be done. I myself am running video consultations, and I see many children with both problems where it's absolutely possible to start already with dietary management principles. So you then want to, once you've repeated the measurements, you also want to record a food diary. The reason you want to record a food diary is for two reasons. It's number one, to see for yourself what is happening. Is this just my imagination that my child is actually eating worse, or is this actually real? Second reason is, as I already mentioned, the vast majority of healthcare providers would be giving you some kind of phone or video consultation service. So therefore, by having this food diary ready, it is part of a puzzle that a healthcare professional will use, because they would ask you for a weight, a height, or a length, and they would ask you saying, please record the food diary. So that would be your next steps. Then there are useful resources for you to already use. There's the Royal College of Paediatrics growth charts, where you can download growth charts. On that site already, there are videos on how to do it. There are videos on how to interpret it. If you're dialing in from other parts of the world, you use the WHO growth charts, which are downloadable, or those charts that have been given to you by your healthcare providers. Then there's lots of information on interpretation of growth charts. Again, it's very similar kind of resources. And of course, I've given you resource today how to interpret this as well. And then there's some useful information on the NICE guidelines, on faltering growth, and on the infant and toddler forum. There's also some preliminary advice that might be useful for you as well. I'm going to end up this webinar just to say that I host webinars every week. So if any concerns were highlighted today, for example, next week I'm doing a webinar on babies that are not growing very well, so things that you can do from home, and I do webinars on feeding difficulties, and I do also webinars on healthy eating. So you can follow me on Twitter and on Instagram, and I normally advertise 2 to 3 weeks in advance which type of webinars I am hosting. I'm going to now open the spectrum to all of you that are attending for any questions. I can see there's already one question that has come through to say that we have absolutely no growth charts. So the pediatrician actually holds all of the growth charts, and that's absolutely true. In some countries, the pediatricians are the ones that hold the growth chart and you've got nothing. So if you've got absolutely no information available to you, go on your country websites and just Google which growth charts. If it's not evident with which growth charts your country is using, then what I would normally say, go to the World Health Organization and download their growth chart and plot your child on there. Now, of course, you'll be plotting your chart for the first time if you've got absolutely no record then at home, because you'll then just have one weight and one length. If you've just have got one weight and one length, then it's very difficult to interpret, has it gone down or has it actually gone up? Then you use your secondary markers, as I said, those proxy markers. So is your child outgrowing the clothes? Is appetite going down? Is it going up? No change in appetite? And also, are there any worrying signs in terms of symptoms, vomiting, diarrhea? And if the answer is no to all of those, then I would say no concern, but then critical, Repeat that weight. You don't need to repeat the height necessarily in 2 weeks' time, because you would not see a huge difference. But then repeat that weight again in 2 weeks and a month's time, because then you are starting to build up for yourself a little growth chart to say, okay, is my child now tracking according to what I have? And then, of course, as soon as the lockdown is over and you have access to your pediatrician notes, you can then access those and compare the notes where you are. At the moment, I'm not seeing any further questions coming in. And if there are not any further questions, I'm going to finish the webinar now, but do let me know if there are any further questions as you think about it. For those of you who've lost me during the webinar, of course, let me know. Once I get the webinar recorded on my cloud, I will send you a username and password, which will then allow you to open the webinar for a specific period of time. Of course, the webinar is copyrighted to me, so the use is only for you. I'm therefore going to say, I hope you all have a really good rest of the day. Look after yourself, follow government guidelines in regards to lockdown, and thank you for making the time. Goodbye.